Okay, so we're going to learn a little bit about inflammation. Inflammation is a response in our bodies that allows the blood vessels in our tissues to respond to foreign invaders such as bacteria. Some signs of inflammation could be uh, heat, which is caused by vasodilation. So we have these little indicators. So when we feel something, histamine's going to come in. And histamine's just going to really tell the blood vessels to widen or vasodilate, to open up. And what this does, allows more blood flow to the area, which is going to allow for, which is the next step in redness. Redness is caused by an increase in blood flow to the area. So if you ever had like a blister or something and you see or pinch yourself on the skin, you can see what it does is allows histamine vasodilates the blood vessel so more blood flow can go to the area. And the reason why we want more blood flow to go to the area is because we want a more increase in we want more increase to that area so we can have more red blood cells and eventually white blood cells to that area to sort of help clean it up a little bit. So the next step we talked about is heat and redness, and now you'll see some signs of swelling, which swelling is again the extravasation of fluid. So what it does is fluid is going to the area and it's accumulating. What this is the spilling over of some chemical mediators like histamine, excuse me, not chemical mediators, fluid mediators like histamine and serotonin, and these things are really spilling over and making sort of forming that blister kind of area. And that's the accumulation of fluid or swelling. Pain that you're going to feel is caused by cellular influx of white blood cells. So fancy names like neutrophils or leukocytes that are coming in and trying to clean up this infected area, like we said, of a foreign invader bacteria. And then what it is that's how you feel pain. It's really getting out all the bad and foreign invader stuff or the bacteria that's in your body. And that's why it sometimes feels painful in those red areas. So what it does is, after all that's being filled or trying to clean up, then you have a clotting factor, which tries to repair that damaged skin or that damaged epidermis. And at that time, we have things that are trying to coagulation factor or stopping that from bleeding or from injuring more. So that occurs between, it could be minutes, hours, or even days sometimes. But that's acute inflammation. Those 4 steps: heat, redness, swelling, and pain. And acute inflammation should, again, only last for those few days. And that's really about acute inflammation. Chronic inflammation lasts about days, months, or maybe even years, but it's the repetition of those processes like rheumatoid arthritis. So that's a big thing about acute inflammation, and I hope you learned something today.